We are following breaking news right now. Mayor de Blasio is holding a press conference at One Police Plaza to give an update on the latest coronavirus outbreak numbers. Let's listen in.
And everything's very dynamic, as everyone is seeing, so these numbers can move at any given moment. But as of this moment, I've got, obviously, we'll talk about the 4 confirmed cases, the 4 cases that tested positive. But now the number of negative cases is 26. We have 26 tests completed, come back negative. We have 2 new cases confirmed this morning in New York City, a man in his 40s, a woman in her 80s. Both are critically ill at this moment. Both did have substantial pre-existing conditions. In the case of the man, respiratory issues related to smoking and vaping. In the case of the woman, specific illnesses related to her advanced age. One is at a hospital in Brooklyn, one is at a hospital in Manhattan. Again, we're going to try always to define what we are able to tell you, what we're not yet able to tell you. Obviously, there's a confidentiality issue here that we have to be sensitive to. These are voluntary hospitals, not public hospitals. Okay, now this gets into the issue of community spread, which we're very, very concerned about, obviously, and this is kind of defining changing reality. So today we're going to be talking about some strategic differences even compared to yesterday, now that we have more evidence of community spread. So in the case of these 2 individuals, neither one had a connection to the areas affected in other parts of the world. So there's no travel nexus. Neither one connected to any of the other cases we've seen. Our disease detectives are working with their families right away on mapping their contacts, and we'll have more to say on that shortly, and we'll obviously be following up with any close contacts. The community spread issue, we are seeking guidance from the World Health Organization and from the CDC, now that it's clearly established as a phenomenon here. We are trying every day to get a better understanding of this still new disease. We are not getting all the answers we would like, but to be fair, the entire medical community around the world is trying to get clearer answers and clearer facts. What we do know is when you have a community spread dynamic, you have to assume it could be anywhere in the city. So we're going to work on an assumption of intense vigilance. We're going to update our approaches as we get more information. A phrase that I've just learned, transmissibility, is sort of the amount or the ease with which this is transmitted. World Health Organization continues to say this disease is less transmittable than the flu. But again, we are watching carefully. Community spread dynamics suggests it will be more pervasive, and that worries us, obviously, in terms of how easy it might be for someone to come in contact. Again, goes back to what people can do, and this is the consistent part, because it is affirming, as we used the example yesterday of the measles, it is not a disease that the substances hang in the air, and if you come into a room where they've been present, that it's easy to contract. We know that is not the case. What we're concerned about is direct contact with fluids. And so that's the area where people can do all the smart basics, the hand washing, the alcohol-based hand sanitizer. Thank you, Commissioner, you've gotten that in my brain. Obviously, covering your mouth when you cough and sneeze, all those basics really matter. Notwithstanding our real concern about the situation, the overall numbers still remain, in a sense, very favorable. We have only 4 confirmed cases, obviously, out of 8.6 million people. We have 26 tests that come back negative. I want to note, I should have said this up front for continuity, the 2 yeshiva students who the disease detectives identified from the first yeshiva student, so that is the roommate and the best friend of the student from Westchester, both have been tested, both came back negative. So they're in that negative number of 26. So again, by the numbers, we remain in a strong situation. The community spread dynamic is unpredictable and worrisome. So we're watching carefully, and I want to alert everyone, each day we may tell you we're finding something new about how this disease is acting in general, how it's acting here in New York City. So our level of concern is rising for sure. That said, the big picture point, I'll keep saying it, we do know this for a fact, over 80% of the folks who get it have very mild symptoms, very mild experience. And the vast majority of folks, even who have more serious outcomes, still end up seeing it through. So it comes back to, I'm making really clear, we believe in a containment strategy. We understand there are limits to that at a certain point, but that is the strategy we're using. We believe in a strategy that focuses on identification and testing. We believe deeply in the work of the disease detectives, and we will be introducing you to some of them soon so you can get to see the real human beings who do this important work. But finding everyone who needs a test and getting them a test as quickly as possible and isolating them when they need to be isolated is the smart strategy. We have a directive for all New Yorkers. I'm first going to talk about all New Yorkers, and then I'm going to specifically talk about city workers. For all New Yorkers, if you have returned from one of the 5 countries I'll indicate, we're asking you to isolate yourself for 14 days as a precaution. Any New Yorker coming back from any of these countries, China, Iran, Italy, South Korea, all on the current CDC list. Japan should be on that list, we believe. So from the point of view of New York City, if you're coming back from Japan, you should isolate for 14 days. And obviously, if you have symptoms, then you need to get to care and testing. Now, this is a brand new thing I'm going to introduce to you today, thanks to our health commissioner. This order is being issued as we speak, commissioner's order. And this refers to city workers, specifically first responders, healthcare workers, and educators. So this will be up online momentarily. Under this order, the commissioner has the ability to determine case-by-case specific actions. And if the commissioner determines that anyone fits the criteria and is a risk, they can be required to get a coronavirus test. Right now, I can tell you, anyone who has traveled to one of the affected countries and has symptoms will be required. And the broad assumption is that those who have symptoms alone, except for particular extenuating circumstances, anyone who has symptoms will be required to get tested, and we will act in accordance to that test in terms of if and when they can return to work. Anyone who refuses testing must comply with a quarantine, and there will be specific employment consequences if they refuse testing. We'll get you the details on that. I want to also emphasize, again, I think we're in a very dynamic crisis, which I have said to you guys, I believe will be months if we're lucky. This is the first commissioner's order. I doubt it will be the last. You will see evolving actions. This one refers only to city workers. Obviously, the commissioner has the power, and I have the power to do things related to the general public as well. So we're going to take each step as needed. We'd love it if we don't have to take a lot more steps, but we are prepared to do a lot more the moment we need to. Consistent with the topic of city workers, update related to schools. So we have 3 teachers who have recently come back from Italy. I'm going to give you a lot of detail on one, and then there's 2 more where I can give you a little detail, but we will have more specific as soon as certain notifications have been made. The first teacher was part of a high school trip at James Madison High School in Brooklyn, 3787 Bedford Avenue. 44 students and this teacher plus 6 other staff members went to Italy. My understanding is to one of the affected areas of Italy, and that's important here. Obviously, countries are experiencing this crisis, but there are areas of particular concern. Came back on February 23rd. The teacher was symptomatic. The teacher has been tested. The teacher tests negative. We are assessing all the other staff and students on the trip. At this moment, we have none with symptoms. And we believe we have a low-risk situation, especially given that we're getting close to the 14-day mark. But they are being carefully assessed. If anyone needs testing, they will get it. This is a good example of a situation I want to clarify about. We've been talking a lot about how to talk to parents. And I'll say this, and at any point now or in the back and forth, my health colleagues will jump in. But the basic guidance to parents who are very, very concerned right now is if your children are healthy, at this moment there's very, very little to be concerned about. If your children have serious respiratory diseases or a compromised immune system, we want you to be extra vigilant. And we want, in that case, we obviously want to make sure our schools are aware of those particular students. So looking to the chancellor and the health commissioner and the deputy commissioner that we obviously have the ability with school records and school health facilities, something you used to do, to understand school by school who those students are. We're going to have particular sensitivity around those students. But at this moment, because there's not a single symptomatic student anywhere in New York City public schools that we know of, we're not taking an additional action. But that, just the human guidance to parents, and I'm saying this as a parent, based on what our public health officials are saying, is only if your student has a serious respiratory problem or a compromised immune system is there an immediate threat. Otherwise, as everyone is seeing, this disease disproportionately affects older folks and folks with serious pre-existing conditions, but obviously, overwhelmingly, it's been adults. 2 other teachers. In this case, they both returned from a vacation in Italy over the winter break. So again, we're getting close to the 14-day point. We will have more information shortly. Both are being tested today. We'll have the results on that shortly, and then we'll talk about pending notification of specific schools and any other follow-up. But again, those teachers just went themselves personally on vacation, not with students or other staff. I want to give you a couple of agency updates. Department Correction. All housing units, day rooms, and common spaces are now being cleaned once per day. Shower areas are being cleaned 3 times per day. Transport buses are being cleaned and sanitized daily. Staten Island Ferry, every ferry, each boat will get a deep cleaning every 72 hours minimum, often more than that, more frequently than that. Terminals will be consistently clean, constantly clean. DOT crews are also handing out material on the ferry to educate customers as to the facts on the virus. Those, I obviously gave you some other agency updates yesterday. Those are some of the things that are happening in our government, but I want to emphasize what we need from another government, the federal government. This is still the case, even though there was a little progress last few days, it's still not what we need. We need the ability to test as many people as possible, as quickly as possible. We cannot do that without help from the federal government, period. The CDC has finally broadened the criteria, which is good, but we do not have the physical capacity we need. We need the FDA to speed up approval of the tests developed by private companies. We just need this to be a consistent effort by the federal government. It has not been. The goal has to be to decentralize testing as quickly as possible and maximize our ability to do what we need to do. One other piece of news literally coming in just before I came out here from New Jersey, but related to us. We have 1 new case in New Jersey that has a significant nexus to New York City. We don't have the details yet. Our health authorities are speaking to the New Jersey health authorities. I will be speaking to the lieutenant governor, who's in the role of acting governor because Governor Murphy has been in surgery. So acting Governor Sheila Oliver, I'll be speaking to her later on today. We will get you an update as soon as we have more of the details. We're going to have our disease detectives engaged with the health authorities in New Jersey to track what that nexus is. So we know there's a case and we know there's a nexus, but we don't have the details on that. Hopefully we'll have that in a matter of hours. Few quick words in Spanish, and then I'd like to have the Speaker of City Council, Corey Johnson, say a few words before we open up to questions. Confirmamos que ya hay más casos de coronavirus en la ciudad de Nueva York. Necesitamos que el gobierno federal actúe más rápido para que podamos ofrecer el examen de coronavirus a más neoyorquinos. Si tiene algún síntoma, vaya al médico de una vez. With that, I'd like to turn to Speaker Johnson.
Thank you, Mr. Mayor. I want to thank you for the level of transparency that we have been showing as a municipal government, which I think is incredibly important. I want to thank your team. I especially want to thank Dr. Barbeau for her steadfast leadership throughout all of this. I know that there is a lot of misinformation out there, so as the mayor has done consistently, I think it is important that we urge the public to be guided by fact and not by misinformation, not by fiction. You can still ride the subway. I did it today from Union Square down to City Hall. You can still go to school. There are plenty of young people who are in our schools today. You can still go to work. New Yorkers are still working all throughout the 5 boroughs, and you can still go enjoy a concert or a basketball game. It's important that we get out there, that we are taking the precautions necessary, that there is, of course, rightful concern about what the city is dealing with, but it's also important to know that we are being guided by experts, and those experts are our public health department, one of the best in the world, and the disease detectives that the mayor talked about that are doing this work every single day. So it is natural that people have questions, it's natural that people have concerns, and it's why in just a little while we're going to have a hearing at the City Council, not a long hearing, but a hearing with the professionals that are sitting up here before you to, again, answer these questions in a fact-based, sober way to New Yorkers. City Council members' offices are getting phone calls every single day from constituents that are concerned and want the facts out there, and so the mayor has been doing that, the governor has been doing that, the council is going to do that in the form of a hearing today. People are rightfully concerned, and I want to thank the administration in advance for participating in that hearing and for the work that we have done together. I think it's important to update the public and provide them, as we have been doing, as the mayor has been doing, every day with transparent, accurate, fact-based, science-based, sober information that people can use to deal with their concerns. And then just lastly, we know that there are likely going to be new confirmed cases in our city in the upcoming days and weeks. And the way to combat that is to use the facts, use the science, listen to the public health professionals. If things need to be escalated at some point, that will be communicated to the public. That is not where we are right now. And again, to ask the public to use common sense health measures, to wash their hands, to use the hand sanitizer, to cough in their elbow. And then lastly, one final thing. Last night, my boyfriend and I went to dinner in Chinatown on Bayard Street to one of my favorite restaurants, Deluxe Greenbow, and we had some soup dumplings, and it was great. The thing that wasn't great is that a lot of the restaurants were empty in Chinatown. And we have been seeing this in Flushing, in Sunset Park, in Chinatown. We have been seeing anti-Asian bias incidents happen throughout the city. We have even been seeing anti-Semitism directed at Orthodox New Yorkers. It is unacceptable. It is not based on science or by fact. We will not tolerate it here in New York City. We will be guided by public health professionals, by the mayor and his team, by the governor and their teams. That's what we will do. We will not put up with people discriminating against New Yorkers based off of prejudicial, incorrect information, and it's important that we continue to say that over and over again. We are better than that. We are the greatest city in the world, and it's time for us to show it in the midst of this crisis that we're going through. 99% of New Yorkers have been showing that. But for the 1% of New Yorkers that are behaving this way, stop it. It's unacceptable. We won't put up with it. It's not the way to get through this crisis. Thank you, Mr. Mayor.
Thank you, Speaker. I couldn't agree with you more, and thank you for that rightfully passionate statement. Yeah, we're just not going to I want to amplify it. We're not going to accept any discrimination. There are real consequences. Some forms of discrimination are legal, and you will feel the consequences of it. But also, if anyone's paying attention, this disease is now in, I think, 79 countries of the world. So it is unfortunately affecting people of all backgrounds, all nations. We have no time for discrimination. I also want to thank the Speaker. Appreciate the hearing he's having. I also want to thank him for riding the subway. I want to inform you all that I'll be going from City Hall to OEM by subway, and you will all be welcome to join. Anyone who wants to come along a little bit later on this afternoon. Go ahead, Katie.
So the CDC added Italy to gave it a level 3 non-essential travel warning a week ago. I want to know, why didn't the DOE, and if they did, I'd be happy to be wrong, why didn't the DOE proactively go and see what schools had trips to Italy and the other countries, South Korea and Japan? We're just now finding out that 50 people from a school traveled to Italy for February break. One had symptoms, and I just want to know if that was done, let me know, and if it wasn't, why not?
So again, you said it was added a week ago. These trips were in February. So as the information was coming to us, we're going back and finding out where our students going, where were these trips planned for. Large agency, lots of groups moving. The good news is going forward, we have very, very clear protocols. We now have an inventory of all of these trips, even trips to non-designated countries. We're sharing those trips with our partners in the Department of Health to make sure that there's nothing brewing that they know of that we don't know of. So going forward, we have tight controls.
Did you not have an inventory before? And could you let me know if there were other trips made during February break?
Yeah, we can get that information to you. But again, we are going back, and there are some trips, quite frankly, that even are unofficial trips. They're paid for by parent organizations. They're paid for by church-related organizations. So we're trying to get an inventory of everything and everywhere, and we're in the active process of that. We've been doing that for about a week as well.
With all due respect, I know teachers who probably can't go to like the Hall of Science without notifying their district. I'm just trying to clarify, usually the Department of Education wouldn't know if a school sanctioned DOE trip with 50 people from
That's not what I'm saying. What I'm saying is that there were a lot of trips. There was a lot of information. CDC was changing and giving different guidance. We're working through the Department of Health as well. A lot of moving parts.
Right, Richard, let me just for everyone's sake, I used to know when I was a parent. I don't know what this year the exact dates of winter break were. If we could give that, I don't know if you have it at your fingertips, but we can get the exact dates of winter break. I think it will help to answer the point that's being raised here. But the bottom line is we're going to inventory everything now and go back and look if there's anything we need to follow up on specifically.
The point wasn't that they shouldn't have traveled. It was that once they returned.
I've been very clear. We're going to inventory everything, and we're going to be very transparent about it.
I just want to clarify 2 points. The first, the 2 new cases in New York City, the man in his 40s, the woman,
Yeah.
is there any connection between the 2 of them?
No.
No. And can you clarify?
I'm going to double check. No.
And are there 3 confirmed cases in New York City or 4?
So 4 if you include the guy from Westchester who worked in New York City, lived in Westchester, but is in a New York City hospital. So we're calling that New York City for the sake of abundance of inclusion.
You're saying 4 in New York City, but that includes the Westchester.
Correct.
About the lawyer, his wife, do we know if his wife had traveled to Israel?
We know he traveled to Israel. I don't know if we know his wife traveled to Israel.
I'm not aware of her travel itinerary. We do know that he traveled to Israel, but way before he got
But she is, again, there's so many cases I'm trying to make sense. She's asymptomatic.
Correct.
Okay.
I have 2 questions. One is, yesterday you said there'd be an update to the protocol regarding staff who show symptoms at school.
When you say staff, I'm sorry.
Teachers at
Teachers,
school.
yeah. That's the commissioner's order.
Okay, so that is how you're dealing with teachers at schools. Also, also, the teacher who you said today had been tested, it was negative, is that the same one that we talked about at yesterday's?
Yes.
press-
I believe it's the same one. I think, again, I'm trying to keep my continuity tight. I'll say it again, just make sure we're all over communicating. James Madison High School, this is a teacher, went on an official school trip with students over there, again, tested negative. We'll have the other two teachers' results today.
Mr. Mayor, can I amplify? There was additional guidance and protocols that were sent to all 152,000 employees in the DOE today with very specific instructions. We've also updated our guidance to all principals about how to work with students, how to work with other staff members if they are presenting. So there's been updated guidance as well.
Just ask the DOE press office to share that, because we haven't been able to get any.
Yeah, absolutely. Absolutely. Just went out.
Your reassurance via Spanish, please.
Sure. Say that again.
Can you just relay any reassurances by Spanish?
Sí, para todas las familias que hablan español, estén asegurados que tenemos información en las manos de nuestros directores, en las manos de nuestras escuelas, que tienen instrucciones específicas acerca de cómo tratar con niños que están demostrando síntomas de la influencia, de la gripa. También tenemos a personas identificados en cada escuela que están capacitados para poder servir y ayudarles a las familias, ponerlos en contacto con las autoridades de medicina o de salud.
Just a few questions wrapped up under the quarantine headline. There are 1,000 people quarantined in New York State. I wondered how many in New York City. Are any of those involuntary? And how many how many Department of Health staffers do we have to check in on them? And are you worried about a shortage of staffers to check in on the quarantine?
The last point I'm saying, we're obviously in a crisis. The message to the Department of Health is that whatever staffing they need, if they need to hire new, if they need to gently borrow from health and hospitals, which has been wonderful about offering personnel, or from any other agency, there's not going to be a staffing shortage. That will be whatever they need, whenever they need it. As to the quarantine numbers and whether there's any involuntary, you two.
So I'll start and then.
Turn that on.
Sorry.
Yes.
I'll start, and then Dr. Daskalakis can add anything that I've missed. With regards to individuals that are returning from the involved countries, the guidance from CDC, and we, along with our state partners and various jurisdictions across the country, are taking the approach of providing them information when they get off the planes, giving them our phone number, what symptoms to look out for, and then we reach out to them on a daily basis to make sure that they are not developing symptoms. It's what we call voluntary home isolation. And so they have a phone number to call us if and when they develop symptoms. There haven't been any individuals in that group that have reached out to us thus far. And then we have individuals who are in mandatory quarantine, and I'll let Dr. Daskalakis speak to that.
Currently, individuals who are under mandatory quarantine really fall into two categories. Individuals who are, actually three, individuals who have active COVID-19 disease, so they're in isolation. There are also individuals who are close contacts of a COVID-19 case. Those are also individuals who are on quarantine. Then additionally, it is a dwindling population of individuals returning from Wuhan, China. So currently there is no one who meets that criteria.
What's the universe? How many people are in quarantine, mandatory versus voluntary?
If there's any, let me pause you guys. It's a very, very fair question. If you are 100% sure you have all the up-to-date facts, give them. If not, we should get back shortly.
So we have the two individuals. Sorry. We have the two individuals that we have identified earlier as having a travel nexus to Iran. And in addition to that, we have a a number that changes on a daily basis in terms of returning passengers from the 5 affected countries, China, Italy, Iran, South Korea, and now Japan. And so that's a fluid number that we can get back to you on. I think, yeah, we'll get back to you on that correct number.
Sorry, one last follow-up. How often are those unannounced spot checks that you mentioned yesterday?
During the period of quarantine, they're done a couple times a week.
Yeah.
Is there a nexus with the 42-year-old man in Nassau County who was diagnosed with the COVID-19 to New York City?
I have not heard, haven't heard on that one if there is a nexus. Do we know anything yet?
Which person in Westchester?
There's in Long Island in Nassau County. The governor today said that there was a 42-year-old man who tested positive. Are you looking to see if there's a nexus, or you know that there isn't?
We'll have to follow up. Usually what will happen is they will reach out to our disease detectives to have conversations, so I'm sure that those are happening, but we'll follow up.
Can you clarify how many tests New York City has if you're running low, and also the type of test, if it's the one developed at Albany or if it's a CDC test?
So currently we have enough tests to test around 1,000 people. The test that we're currently using is the kit that was shipped by the Centers for Disease Control. We have not brought the New York City cooperative test on board yet.
What is the nexus between the New Jersey case and New York City?
That's what we're waiting to find out. So we do believe from the initial information there will be, for example, someone who works here, you know, that's the kind of thing. But it's really literally was breaking before I came in here. So we know enough to say we assume it's someone who's been in New York City a lot, and there may be that kind of contact. We got to get our disease detectives connecting with the New Jersey health officials and map that quickly.
Do we know anything about their travel plan?
We don't know anything yet, but we'll know more in the next few hours. Go ahead.
And Mayor de Blasio giving an update on the coronavirus outbreak from one police plaza. 4 positive cases in New York City. 2 of those are new cases. Both are critically ill. One is a man in his 40s with a history of smoking and vaping. Another is a woman in her 80s who has pre-existing conditions related to advanced age. Now, one of them is at a Manhattan hospital. The other is in a Brooklyn hospital. Neither are connected to areas affected in other parts of the world, and they are not connected to other previously confirmed cases in our area. We do want to note that 26 tests in New York City came back negative. Any moment now, we will be listening in to a coronavirus briefing being held in New Jersey. In the meantime, stay with us. You're watching CBSN New York.